Your depression medication may be destroying your marital relationship. You say, but Dr. Wadsworth, my depression ruins my marital relationship. So what then? Do you either have depression and a terrible marriage relationship, or do you have treated depression and a terrible marriage relationship? Are those the only options? Are there other options? Sometimes there are other options, but they're not as easy as taking a pill. And this is not going to work for everyone, but it may work for some people. First of all, how could your depression medication be ruining your marriage relationship? Lots of depression medications destroy libido, and the number one reason that most people give for divorce is the sexual relationship is ruined. It's very difficult to have a good sexual relationship if you have no libido. If you're having this problem, I recommend going to your psychiatrist and saying, hey, this is my problem, is there any way around this? Sometimes they can find other medications that can preserve your libido or help your libido, and you can still get your depression treated. Now, if you have bipolar depression, this may not apply the same way as major depressive disorder. And some cases of major depressive disorder, this may not work either. But here are some of the things you might look into doing. Please talk to your psychiatrist before doing any of these things, though. So, researchers took a big group of depressed people. They broke them into groups. One group was a control group that did not take any medication. Another group was a group that was taking medication. And the third group was a group that was not taking medication, but was exercising. 30 minutes of cardiovascular exercise 3 to 5 times a week with a heart rate above 120. The group that was taking medication did outperform the no medication group, but when they compared the group that was taking medication and the group that was exercising, the results were very similar. What this means is that for many people, exercising can be as effective as taking your medication. Again, this doesn't apply to everyone, so please talk to your psychiatrist before doing this. I'm just telling you the results of the study. And this does not apply to conditions like schizoaffective disorder or bipolar disorder. This is for major depressive disorder. And here's the thing, is that exercising does not lower your libido, it actually raises your libido. We don't know exactly why this happens, but here are a couple theories. It increases blood flow. Blood flow to different areas can help things to happen better. More parts of your brain are activated. More brain activation can help things to function better. But also, fat produces estrogen, and estrogen can reduce libido. However, exercising has been shown in many instances to increase testosterone, and higher testosterone is linked with higher libido. Both men and women produce testosterone. Men do produce more testosterone, but women likely produce a lot less testosterone than they used to. Why? Because people have more fat nowadays than they used to. More fat means more estrogen. The testosterone is converted into estrogen, which means they have less testosterone and more estrogen. So I'm not saying for you to just go out and stop taking your depression medication. Go talk to your psychiatrist, look into other options, and see if there's anything else available to you. And start exercising. 30 minutes a day, 35 times a week with a heart rate above 120 if your doctor recommends it.